Today we're going to be talking about breast symptoms, which are common and often quite frightening, but the majority are not actually caused by cancer. And in this episode, Javeria is going to explain what breast changes are normal and what symptoms should be checked urgently and what we can expect when we attend a breast clinic. Because I think, for many of you like me, we go and have our checks, we're good, we go and have a check, we expect it to come back. And if it doesn't come back normal and they say, could you come in? I think the alarm bells start ringing. So, Javeria, welcome properly.
Thank you. And yes, I agree. We see this all the time in breast clinics, women presenting with symptoms of breast lumps, pain, nipple discharge, changes, and they get frightened because the first thing that comes into their mind is that, is this breast cancer? But surprisingly, most of the symptoms are not related with breast cancer and are not a cause of breast cancer. And we see these women, and this is our daily job to see these women, get the necessary test done and send them home all reassured. So yes, if you do have any symptoms like this, I encourage people to please get it checked in the first instance. And most of them are, ladies are mostly reassured and sent home feeling relieved.
Absolutely. But it's taking that, okay, and not sort of just putting your head in the sand or whatever we're all guilty of doing that at some point. So what are the most common sort of symptoms that we might expect if we're examining? Well, actually, maybe before we talk about that, talk about examining breasts. We all know we should be doing it, but do we do it? Maybe we're not all as good as each other, but
Yes, I agree. We This is something that we should be doing as a woman, and I always say that to my patients that the best time to examine yourself, if you are having regular periods, is 1 week after your periods, when all your hormones are back to normal. And I don't encourage examining more frequently, because if there is a change, then you will not notice it if you're examining yourself, let's say every day or every week. So once a week is a very good practice. And why we advocate that is that if you are able to detect cancer earlier, the management is totally different from when it is when it is diagnosed in a later stage. So, for example, if it is diagnosed early, most of the women can just get away with surgery and a few weeks of radiotherapy, and then some tablets to take home, which they take for 5 or 10 years, depending upon the pathology. And the more reassuring thing is that the earlier it is diagnosed, the higher the chances that we are able to save the breast and the woman doesn't need a mastectomy. So that plays a very like very unique role in patients like long term outcome, because if we can save the breast, then it's very good for their confidence, their um, how they feel about themselves later on. So yes, I really encourage women to examine themselves more frequently.
okay.
Yeah.
So going back then to doing our examination, what are the sort of common symptoms that we might feel and, what is normal? And then when do we start worrying? What are the red flags?
So the common presentations to the breast clinic are women presenting either with breast lumps or lumps in the axilla. They can have changes into the skin of the breast, which we call as an orange peel appearance, in which the breast develops some dimpling and some redness. There can be changes to the nipple. The nipple can get inverted. There can be nipple discharge, and the discharge can be from one side, from both sides. And of course, the most common frequently presenting symptom to the breast clinic is just breast pain, which most of the time with breast pain, we say to patients, is not a cause of breast cancer and is not related with breast cancer, but it does cause a lot of anxiety to women. So women who present with breast lumps, so any new lump in a woman in the breast or in the axilla needs to be assessed properly. And we all breast lumps that are presenting after the age of 25 need to be having a biopsy to prove that they are not breast cancer and they are benign. saying that most of the breast lumps are not cancer, and they're either breast cysts or what we call as breast mouse, and the medical term for it is a fibroadenoma. So most of the women end up having that, but unless and until cancer is ruled out, we can't completely dismiss a breast lump altogether. So yes, if any woman feels any breast lump, they need to attend the breast clinic. Now, talking about nipple discharge, common presentation again, women can have discharge from one nipple, from both. The sign to look for, the worrisome sign, is if you're having blood-stained discharge or serous discharge, which is just like water from one duct, then that is worrisome and needs to be checked. Other discharges, like if it is multicolor, multi-duct discharge, yellowish, green, those sort of colors are usually physiological and can be ignored. Another common symptom, as I said, are skin changes. If you're having noticing any dimpling, that needs to be checked, and breast pain, of course. Breast pain is a common.
Can I just, sorry, interrupt? What is dimpling?
Yeah, so dimpling is that when you notice some sort of indentation in your skin, that at some point your breast skin seems retracted or is going in, more pronounced when you're raising your arm. So when you raise your arm, the women feel that at some point the skin is going in. That can be at one point, or like a putty orange appearance, which is basically a skin peel appearance. When if you notice the skin of an orange, it has multiple dimplings, so that is what it is. If you're having that at multiple areas with some redness, then it is very important to rule out what we call as inflammatory breast cancer, because that type of breast cancer can have this sort of presentation.
And then going back onto another point that you said is checking from the age of 25. Is that because it's not often that people check before that 25, or what?
So what I meant with that is that any new lump in a woman who's above the age of 25 always needs to be biopsied. Below the age of 25, even still, if you're feeling a lump, you still need to get it checked. But we usually do not biopsy it if it is fulfilling some ultrasonographic criteria. That then we do not biopsy it and we leave it as it is, unless it is increasing in size and it's more than 3. Because these lumps usually in younger women are fibroadenomas, and we can leave them alone. However, if it is more than 3 centimeter and it is progressing in size, we do offer excision. But as I said, that every new lump in a woman above the age of 25 needs to be biopsied. Right. So not only needs to be checked, it needs to be biopsied.
Yes. So it doesn't mean that you don't check your breasts if you're under 25. It just means, actually, the good news is hopefully it is just a fibroid as opposed to something else.
Yeah, just a fibroadenoma. So it still needs to be, you still need to come to the breast clinic, you still need to get it checked. And it will only be biopsied if we see some certain sinister criteria in them.
Right. So once we've had that, the letter or a phone call, whatever it is, to go to the breast cancer, we're all like, oh my goodness, what does this mean? What happens when we go to the clinic?
Okay, so once a lady attends the breast clinic, she undergoes what we call as a triple assessment, which means triple assessment means that it encounters 3 different components. The first component would be that you see a breast surgeon like myself, and I will take a thorough history and a full examination of your breasts and your armpits. And depending upon the history and my examination findings, I will then order some images for you, some radiological imaging, which can be a mammogram or an ultrasound or both. And once you've had those imagings, depending upon the findings on the imagings, you might end up having a biopsy. If you do not have a biopsy, then you are reassured and sent home with reassurance that whatever you had was a benign symptom and there's nothing to worry about. There's no scare of cancer there. If you end up having a biopsy, then in that case, we will arrange an appointment for you to see a surgeon back in 2 to 3 weeks' time. In those 2 to 3 weeks' time, your biopsy is processed And there is a protocol. We have a meeting, which we call as an MDT meeting, in which the surgeons, pathologists, radiologists sit together and review your images and your biopsy and make a final management plan for you, depending upon the findings. As I said, most of the findings can be benign, like fibroadenomas, benign calcifications, and certain other benign things. But so in that case, you will see us and we will reassure you and you will be sent home. However, if you end up having been diagnosed with breast cancer, then your treatment journey starts from there.
Okay. And then just winding back again, you mentioned about taking a history. So presumably the history is how does it present yourself, and then presumably the history of in your family of breast cancer.
Yes, so the history has different components. First of all, it will be about the presenting complaint. You've presented to the clinic with a lump, how long you've been noticing the lump. Is it growing in size? Is it decreasing in size? Is it associated with pain or nipple discharge or any other symptoms? And apart from that, your full family history. Does breast or ovarian cancer run in the family? If it does, then which relatives have breast cancer or ovarian cancer, and at what age were they diagnosed with the cancer? And apart from that, we take your hormonal history, because that also has an impact on the risks of developing breast cancer and also on the further management if you do have breast cancer, which means that if you're menopausal, what was the age of menopause? Did you take any HRT? If you did, for how long? Did you take any contraceptive pills? And if you did, for how long? Are you currently on any contraceptives? Do you have the Mirena coil in place? Do you have any other contraceptive implants or sort of any other things like that? And then also a detailed history of any previous biopsies that you've had on your breast, any previous surgeries you've had to your breast, and your medical history, of course, what medications you're taking, and do you smoke or not. So that is all included in the history.
Which obviously is very important for you to know the background fully
Yes.
before you start really looking at what it is. And so, I mean, I know that, I mean, we could talk about this for ages, moving on to the next stages. And I know this is really just talking about what happens if you have a breast symptom, and to encourage people really to go as soon as possible. And I presume, I mean, that's what you were emphasizing at the beginning, and that's probably your final note, is to go and see someone like yourself as soon as possible.
Yes, as soon as you develop any breast-related symptoms, please do not sit on it. Get yourself checked, because, as I said, the early detection is the key. And that is why we have set up the screening programs. The NHS breast screening runs from the age of 50 to the age of 70, and it is every 3 years. You are invited and you get a mammogram done. If for any reason you are in this age range and you have not been invited, I encourage you to contact your GP and to get this referral done as soon as possible. Also, women who are above the age of 70 and who still want to have mammograms, they can self-refer themselves. So you just contact the screening program and they will just enroll you, and you will have these mammograms done for the rest of your life. And it is very important because, as I said, the earlier the breast cancer is detected, the easier is the management and the treatment, and the higher is the survival rate.
Absolutely. And I think that we had Mr. Jamie Vatish talking to us previously about that, is, from 70, it is important to go and then start the self-referral, so
Yes.
that you're on the straight and narrow, so to speak.
Yes, it is very important. And a lot of women don't know about it, that there is this self-referral, self-invitation thing above the age of 70. So that is available and should be used. And in the younger age, self-examination is the key. Examine yourself every month. So, and any change you notice, just get yourself referred.
Absolutely. Well, Javeria, thank you so much for coming to speak to us. And I just think, we all know the great advances that have been made in breast cancer, and awareness is great now, but it doesn't hurt to still be reminded all the time to keep on the lookout. So thank you so much for your time.
Thank you. Thank you for inviting me. And I hope my message is clear. My message is early detection. The treatment is better. The prognosis is better. So please be wary. Do the self-examinations. If you have, if you're in the age group, come to the breast screening. And basically, that's about it. All the best.
Thank you.
Thank you.